Good morning. Thank you for joining us. I'm Dr. Luanne Metz, MLA for Calgary Varsity and the Alberta NDP Critic for Emergency and Surgical Care. I'm joined today by Alberta NDP leader Rachel Notley and by Lisa Sluka and Reed and Jessica and Cadence Nickel, who are here to share their recent traumatic experience with a healthcare system in chaos. You will hear from Jessica shortly. Our health system is understaffed and severely overburdened. Sadly, this is not news to anyone who works in healthcare or to those Albertans who've needed to access publicly funded healthcare services. It's an absolute tragedy that it has been more than 15 months, that's 461 days as of today, since Premier Danielle Smith promised Albertans her government would fix healthcare in 90 days. Not only has the UCP government failed to keep that promise, they've only made the challenges impacting healthcare workers even worse by interfering in the introduction of public health measures. And now, instead of thanking frontline healthcare workers for working long hours to provide critically needed care, they're leaving them understaffed by cutting overtime and threatening layoffs. Healthcare workers deserve the respect and support they need to do their jobs so Albertans will receive the timely, reliable access to quality care that they deserve. I would now like to invite Jessica to share her family's story.
Thank you, Luanne. My daughter Cadence is a 12-year-old little girl with a contagious smile and a zest for life. She was diagnosed with chronic kidney disease in 2022, and in May 2023, we got the difficult news that she had progressed to end-stage renal failure. Because Cadence is not a suitable candidate for dialysis, a kidney transplant was her only treatment option. So we embarked on the rigorous journey to get approval for transplant surgery. Cadence attended countless specialist appointments to get clearance to ensure that this procedure would be safe and successful for her. My husband, myself, and many family and friends began testing to become a living donor in the hopes of finding a kidney for Cadence. Fortunately, I passed the health checks and learned that Cadence and I were a match. While waiting for surgery, Cadence had to be hospitalized twice due to illness. She was weak and unable to fight off infection. Her body was failing her. She was fragile, and we feared for her life. We did everything in our power to keep her healthy leading up to surgery. Our family made sacrifices, including closing my family day home and choosing to isolate Cadence and myself from her brother, sister, and other family members to ensure neither of us would get sick before surgery. Finally, surgery day. December 20th came, and with it, the realization that our hard work and sacrifice had paid off. Cadence was healthy and cleared for surgery. I was ready. It was all systems go. We were the first surgery scheduled for the day, and just after 7 a.m., I was wheeled into the operating room, surrounded by an amazing team, ready and waiting to take my kidney to save Cadence's life. I was put under general anesthesia, only to be woken up shortly after surgery was set to begin, to be told they didn't perform the surgery. I could not comprehend what had just happened. Immediately, I wanted to know what was wrong with Cadence, what was wrong with me, why didn't they take my kidney? The compassionate nursing staff informed me that the surgery was canceled while I was on the operating table because they didn't have a bed for Cadence in the pediatric intensive care unit. There was not enough nursing staff to support our child in the critical moments after a life-saving surgery. As a result, her life-saving surgery was put on hold. I was devastated. My heart was broken, shattered. My first thoughts were, if not today, when? Kidney transplants are only scheduled twice per month. Now we're back on the waiting list. We have to start over. The questions kept coming to me. How will we continue to keep Cadence healthy? Her kidneys are failing her. She is not improving. How will we be able to cope with this delay? This entire process has been very taxing on our family. Mentally, emotionally, financially, we needed this surgery to happen. We needed to save Cadence. All I could think about was how close we had gotten and how quickly the goal of saving our daughter was ripped away from us. We are, and forever will be, grateful for the heroic efforts of the transplant team who took it upon themselves to find a solution so that Cadence would receive her life-saving surgery later that same day and get the proper level care post-operation. It is my understanding that several nurses agreed to work overtime and other ICU nurses came to support in the PICU. We are beyond grateful and appreciative that Cadence and I were ultimately able to receive our surgeries. I'm happy to report that Cadence's transplant surgery was a success. Her kidney markers improved drastically within 24 hours post-transplant. Her blood is now being filtered, and we look forward to having a much healthier, happier little girl as she continues to recover. Cadence's surgery was life-saving. Her condition, emergent. Although we did get the surgeries later in that day, the cancellation in the morning and the trauma we all endured, my family, the healthcare workers, was intense. We were worried Cadence wouldn't survive the delay. And I was put under general anesthesia a second time in one day. It's not supposed to be that way. Just because the surgeries were planned does not mean it was not emergent. There is no question that without intervention, Cadence's health would have continued to deteriorate. Her life would have been at risk. It took teams of people months to facilitate getting Cadence to surgery, yet it only took a moment to cancel it on the day she was set to receive that surgery. The doctors and nursing staff are not to blame for what is so wrong in our healthcare system. What happened to us is indicative of a much larger problem with the system, and this must be addressed. It is, if not for the amazing efforts of everyone who made our surgeries happen that day, we would be back on the waiting list. And I'm not sure that Cadence would have lasted the next opportunity. There needs to be a much greater investment in our healthcare system. Cadence deserves it. The tired nurses, doctors, and hospital staff deserve it. Who is going to ensure that what happened to us doesn't happen to other families in the future? It is not a surprise that each year flu season puts a heightened demand on our healthcare resources. Why isn't Alberta adequately prepared for this demand? We are calling on the UCP government to act immediately to support our public healthcare system. The pressures being experienced by our healthcare workers are unsustainable, and it would be an absolute shame for these heroes to walk away from this profession because they are overworked and burnt out. We all deserve more. We all deserve better. Thank you.
Thank you, Jessica, for sharing your very personal story. We're so glad that you and Cadence have recovered so well. I would now like to invite our leader, Rachel Notley, to the microphone.
Well, thank you very much, Luanne, and thank you so much, Jessica, for sharing your family's experience. I really can't even begin to imagine what you were going through, what your family was going through when you woke up from the anesthetic to find that your surgery hadn't taken place. Danielle Smith claimed more than 460 days ago that she was going to fix healthcare and fix the staffing issues that are impacting our healthcare province-wide. Not only has she failed to stem the crisis, but she has such disregard for healthcare workers and those Albertans who need their care that she's failed to honor vital promises like funding to support the stabilization of the practice of family and rural physicians. Yesterday, Alberta Medical Association President Dr. Paul Parks said not 1 cent of that promised funding has come to doctors, and the situation is so dire now that up to 60% of family physicians are thinking about leaving their practice. And new figures reported on Monday showed that emergency departments in Alberta were forced to close for more than 38,000 hours in 2023, again, because of staffing shortages. And most of the communities that were left without access during that time were in rural Alberta. Critical staffing shortages across our province have resulted in a torturous experience for patients. Before Danielle Smith's government, we would have never seen someone be put under anesthetic in preparation for surgery and then pulled out because the staffing wasn't there to support the people being operated on. This is a horrific sign the system is getting more vulnerable under Danielle Smith's watch. Now, December 25th, a surgeon and a pediatric intensive care physician from the Stollery Children's Hospital wrote to Minister LaGrange and Premier Smith to explain that the hospital is operating at or above 100% capacity every single day. In that letter, according to the doctors, on December 20th, the day of Cadence and Jessica's surgeries, December 20th was, quote, an especially trying day for the Stollery for staffing and bed capacity, on top of the incessant challenges of our seasonal viral surge, end quote. The doctors explained that, and again I quote, the capacities of our ICUs have been taxed for a few weeks now with extremely sick children, and we have been skirting a balancing act between quality and quantity of care, end quote. The doctors wrote that on December 20th, the operating room was also in an untenable position with 15 emergency surgeries that needed to be performed, several of which had rolled over from the previous day because staff did not have the resources to complete them all. The circumstances of that morning forced doctors to make, and again I quote, brutally difficult decision, end quote, to halt Jessica and Cadence's surgeries, even though Jessica was already anesthetized and 5 minutes away from an incision to remove her kidney. Under Danielle Smith's watch, staffing shortages and space constraints forced doctors at the Stollery to make brutal decisions each and every day. And again, I quote from the letter, we as physicians are put into the impossible position every single morning to decide which child will receive surgery for their brain tumor, heart disease, bowel obstruction, or chemotherapy because there are only 1 or 2 beds open for possible non-emergent admission, end quote. All of this is the inevitable consequence of a government that failed to prepare for a viral surge and a flu season. Rather than encouraging Albertans to get vaccinations against infectious disease to help proactively take pressure off of emergency rooms and healthcare in general, the UCP government actually went so far as to direct Alberta Health Services to remove the words influenza and COVID from advertisements for the province's fall immunization campaign. More than this, though, of course, we need a government that will get money out the door today to frontline health professionals, to family doctors. And we need a government that will stop threatening to fire nurses and who will be respectful and grateful when nurses agree to work overtime to provide care for Albertans instead of threatening their pay and telling them to cut back overtime hours, as the UCP has recently done. Danielle Smith and the UCP must act immediately to support public health care and the Albertans whose lives depend on it. Thank you very much, and any one of us are happy here to take your questions.
Thank you very much. Just a reminder, if you're on Zoom, it's the raise hand function. If you're on phone, it's *9 to get into the question queue. We'll just check if there's any questions in the room. No, then we'll go on to the phones. Please state your name and outlet and who you would like to direct your question to. Lisa, your line should be open. Sorry, caller, not Lisa, but caller, your line is open. Please state your name and outlet and who you'd like to direct your question to.
My question to Rachel Notley. The federal NDP are here in Edmonton this week for a caucus retreat, and they're trying to drum up support here so that they take more seats in the next federal election. Will you be working with Jagmeet Singh and the NDP's candidates to boost support for them here in Edmonton or elsewhere in Alberta?
Okay, sorry, that's a bit of an unexpected question in the context of what we're talking about today. You know, I haven't really given any thought to the way in which I will be working with the federal party. I've regularly supported my federal candidate, Heather McPherson. She's an absolutely amazing representative from my community, and certainly I look forward, at the very least, to supporting her re-election and some of the great candidates that I know that they're putting forward.
Okay, thank you very much. We're just going to do one more quick pass for questions. Just a reminder, if you're on Zoom, it's the raise hand function, and if you're on the phone, it's *9. Seeing none, that concludes our press conference for today. Thank you.
Thank you.